I know what I told you, but now I'm telling you we're facing a new strain. What? It spreads like the flu.
Impossible.
Fine. Go to the hospital, check it out yourself. Go without a mask, you'll see more clearly. You got 19 dead, you got hundreds more infected, and it's spreading like a brush fire. You got to isolate the sick, and I mean really isolate them, Billy. We got to get everybody else back into the houses. We got to keep them there.
We're doing that, Sam.
No, we're not doing it because I just drove through 100 people. And if one of them has got it, then 10 of them have got it. And if one of them gets out of it, then we're in deep fucking shit.
Omicron variant, of course. If you can make it through that movie.
I saw the beginning
Better
of it.
speak Italian.
It looked pretty high drama.
I did that just for you guys. So the Omicron variant. Look, I was living under a rock for like a month. So I didn't really pay attention to anything that was going on in the outside world. And then I hear about this Omicron variant, and then it's just like, is anything really changing? Like, they've gone back to masks here. Everywhere here says, like, regardless of vaccination status.
Right,
You're
right.
wearing a
We have an
mask.
indoor mask mandate here.
Okay. That was something I noticed when I got back.
Right. It kicked in about a week after you left.
Okay. Yeah, and then they got the first cases here.
Right. The first case of Omicron in the United States was here in California. In San
Number
Francisco.
one.
Yeah.
Number one.
Yeah, we're on the cutting edge.
Also, there's a lot of people that fly in and out of here from everywhere. So
Yeah, exactly.
it's
San
like New
Francisco's
York.
a
New
port
York
city.
has a bunch of cases now. But hey, don't worry about it.
Well,
See them Yankees and queer gay lovers up in New York City.
queer Navy men over in San Francisco.
Yeah, exactly. Even though there's really no naval bases here anymore. But yeah. Don't get this. Don't get vaccinated. I mean, apparently this is just more like you need less of a load on your face to get it.
Right. It's more contagious than Delta,
Right.
and also it does seem to be more likely to evade the vaccine, but that doesn't mean you shouldn't get the vaccine. It's still
No, they said
effective.
they said it's based on some kind of hybrid too, like that before they've had. Anyway, I don't know. I came out of like a coma basically, and just all this shit started flooding my inbox and whatnot, my
Mhm.
feed. So
Okay, so what we want to talk about today.
I had like so many notifications from
Oh,
like
I'll
Facebook.
bet. I'll bet you just had to hit.
I just was like, oh, God.
There should be like a never mind button.
Yeah,
Dismiss all.
it's too late. Yeah, well, there kind of is, but
Yeah.
So yeah, I didn't catch up on shit that was going on Facebook.
So some healthcare professionals have weighed in publicly on with Time Magazine about Omicron and what they're really concerned about. And just in looking at this article, it seems like the concern isn't really about Omicron. It's more about just the pandemic in general and how long it's been going on. So it says the latest COVID-19 variant, Omicron, is raising new fears among policymakers, parents, educators, businesses, and, well, just about everyone.
Yeah.
And for good reason, as initial reports suggest that it is significantly more transmissible than prior variants. But for those of us engaged in clinical care and public health, we're an emergency physician and a trauma surgeon. There's a different fear. With almost every part of our system is already overtaxed.
Yeah.
We are on the verge of a collapse that will leave us unable to provide even basic standard care. Even if Omicron ends up being mild, it could well be the straw that breaks our back.
Yeah. So, and then you were saying there's like record people are quitting in record numbers.
Yes.
That was going on before kind of a little bit, I think. But yeah. So people that are suffering from other things are not getting their help, obviously. But yeah, dude, get vaccinated, I think is what most of these doctors are saying.
Yeah, my nephew's a doctor and he gets patients coming into the ER. He's an ER doctor, just like one of the people who wrote this article. And he gets these very sick people coming in and he says, I think you have COVID. And they say, no, I don't.
Yeah.
That's not real. And he says, let's run a test. They run a test and he comes back and says, you have COVID. And
Must have got it from the Jewish space lasers.
must have got it from the 5G that got up
From
in
the
here.
5G.
And
Oh God.
and he said that he's gotten to the point where he doesn't argue. I mean, he is the type of person who would,
He's like, I can't fix stupid.
yeah, that's
Literally,
basically
it's
it.
just
It's
like,
like,
I
I have so
quit.
much work to do. We are so overworked here that I don't have time to have these conversations. You're going to get admitted. And he does get in, you should have gotten the shot. He has said that to people.
Yeah, well-
You wouldn't be here if you'd gotten the shot.
In facepalm news, this is what this doctor is doing right now. And so now we're about to lose a good doctor. Well, hopefully he's a good doctor. What is he? Oh, he's a proctologist. What is he complaining about?
The breakdown in our supply chain, the same factors slowing the shipping of microchips and holiday gifts. Oh, they had to mention microchips. Is part of it.
First world problems.
The simple lack of funds is another cause, especially for smaller and rural healthcare systems.
Yeah.
Early in the pandemic, we canceled elective surgeries to make sure there were enough nurses, beds,
No
masks,
titty
and
job for you.
ventilators.
Oh, we'll have to fly to Europe and get it done instead.
And the problem with that is the way our system is set up is that's how they make their money. So if
Mhm.
people aren't doing these elective procedures, then the hospitals are losing money. In fact, Watsonville, they're declaring bankruptcy.
Okay.
The hospital in
I
Watsonville.
wonder how they'll ever pull through.
Well, I mean, I don't
If
know what
wealthy
they're.
people would pay taxes, then maybe. I mean, how does a hospital go under? Is that even a thing?
Yeah,
I mean,
yeah,
I don't know how that works, but okay.
yeah.
mean-
Private hospitals can go under.
Oh,
That's-
private hospitals.
Well, our hospital's private. I'm
M-
pretty sure.
Dominican is private?
Yeah,
Oh, I didn't know that.
yeah.
I thought
It's
it
owned
was-
by Catholic Hospital West.
Catholic hospitals are supposed to be free to the public.
Well,
I mean, maybe not for elective surgery, but you can have a baby there for free.
well, they can't turn you away if you come in labor.
Well, I'm pretty sure. I mean, can any hospital? I mean, I guess they might. You imagine if you showed up at just the nearest hospital and it was private and you had like a gunshot wound,
Oh no, they'd
and
have
they're
to.
like, no,
No, they have to treat you.
Yeah.
They have to stabilize you. But if while you're there, they discover that you have lung cancer, they might tell you you have lung cancer, but they can't treat you for it.
Oh, okay.
They have to stabilize
You
you.
got to be on their plan. You got to have the right plan.
Well, you got to have insurance, or you got to be able to pay out of pocket.
So the COVID is ravaging its way through our healthcare workers, obviously, and you can't pay them enough to stay in. You can't give them enough money to stay in business. How do we keep a hospital afloat? You just let it go? Like that doesn't make any sense.
Well, there's the financial aspect. There's the hospitals are losing money. That's part of it. But then there's the burnout.
Jesus, where you at, Elon Musk? Mark Zuckerberg's got a hospital.
Oh, that's right. It's a children's.
Yeah,
I think it's a children's
so. I'm
hospital
not
up in
sure.
San Francisco.
No, he just froze on a sneeze.
I wasn't thinking
It's
sneeze.
all right. Nobody's watching anyway.
but
It's all practice.
but the
people.
burnout factor is there's no amount of money that you can throw at somebody to deal with the burnout. They just need to be able to hire more people and have the doctors and nurses working fewer hours.
Well, yeah.
And they need to get this virus under control. And with people not getting vaccinated and
Meanwhile, the pharmaceutical companies are raking in all the money.
right. Oh, that's the other thing my nephew said is, damn, they want the drugs when you come in. They
Well,
don't believe in COVID, but they sure as hell want the drugs.
There's
for
a whole
COVID.
thing now where the pharmaceutical companies are now selling anti-opiate medication. That's a new thing, by the way.
Is it that new?
I know we went off on a tangent here in the COVID corner, but talking about healthcare, I guess it is relevant. But yeah,
Are you talking about Suboxone?
it was a fucking commercial I saw, and it said, but the fact that there's the companies that made the opiates are the ones that are now selling the
Is it one of those things where you
They
if
have-
you take it, it puts the
sure,
receptors
whatever,
to
yeah,
sleep so that you don't
something.
get high?
Yeah, something like that. I guess I don't know,
Yeah, I think that's what.
but just
Suboxone
that's
does.
kind of funny.
Yeah.
Like, hey, if you want some anti-opiate medication, we'll sell it to you.
So is it actually?
I don't know what the
What was
fuck
that
it is.
company?
It just came across my feed. I literally popped in and then I went, huh. That figures. I just
Yeah.
didn't. I wasn't prepared to talk about it on the show, so I'm not. I can't do everything myself.
Yep.
So
So,
that being said, you want to finish this article?
I think we got the gist of it.
Yeah. The Great Resignation.
Also, I wanted to point out there's a show on Hulu called The
Oh,
First
yeah.
Wave,
That's right.
and it's a documentary about the first wave of the pandemic in New York City. Well, not just New York City, New York State, but it's very stark and disturbing, and it shows the burnout of nurses mostly and doctors, but mostly nurses, and how on they are when they're dealing with patients, but then when they leave the patient's side, they're just like,
Right.
oh my god. And I didn't realize what a horrible death COVID is. It is
Yeah,
absolutely,
you basically suffocate.
yeah, you drown.
Yeah.
You drown and there's no water. I mean, it is just,
Mm-mm.
you don't want to go out like that.
I don't look 6 feet. I mean, I'm fine. It's fine. I'm fine with 6 feet away from each other. I'm fine with wearing masks. I'm fine with all that stuff.
It's not the flu.
No,
I've
it's
had
not.
the flu. This is not the flu. This is like
But there are
getting injected with fire ants.
there are people out there that believe.
I think
this
one of the
shit.
principles that people just tend to forget about, which is the proper role of government. The proper role of government is to inform the public, but we believe in the United States of America about self-determination.
So
Self-determination to get
yeah, take it. But that seems like a fucking horrible way to go. Too, like you're fully conscious. Fucking yikes! And you know that you could have done something really simple to save your life.
Well, what they do in some cases is when it's obvious, because people come in multiple organ failure, their lungs are failing, their
They're
heart's
already
failing,
dying.
and their kidneys are failing, and their organs aren't salvageable. So they say to the family, we could put your family member on a ventilator
It's only going
and
to prolong the inevitable.
prolong the inevitable while their organs fail, or we can take them off of everything and give them morphine, keep them comfortable, and that's what they do in a lot of cases.
Self-euthanasia, I believe.
Well, you're not actually killing the patient. The patient will die anyway,
Right.
but they won't be in as much discomfort. And morphine makes you feel like you're getting enough oxygen even when you're not, which is why it's
I didn't know that.
life-threatening.
I did not know that.
Yeah, they give it to you.
I suppose you just get so high that you just are like, this is hot. You just get so high until you just, I don't know, you just go to sleep or something and then die.
It doesn't. It's not like you die. It causes you to die in your sleep. They specifically don't want to do that because euthanasia is illegal. But you would die anyway. But you don't care as much.
You just be like, oh, bro, done. No, I doubt it's like that. Sounds horrible.
No, it's absolutely horrible.
It's like we're going to make you so high that you just don't care that you're dying.
And actually, we don't even know what they're experiencing because we're not experiencing it. The doctors don't really know.
Is that your
either.
expert medical coming to you from the COVID corner? Wisdom, pearls of wisdom.
Well,
there is no lighting in here, by the way.
I know. I was just realizing how
lighting is
dark
really
it's
good in
getting.
this
I
place.
mean, we're actually looking pretty good considering. We'll just
It's got to be the
suck
camera.
each other's dicks for a little while here.
I did all the work. What are you talking about? Just sit here.
Thank you.
Yeah, well, that's COVID corner for you guys. Brought to you by San Juan Slingshots. She's getting hers.
I am so excited. Dr.
couple
Z
days.
is coming on Saturday
Don't forget them.
with my two pink and red San Juan
Davy
Slingshots.
Crockett Rowan.
And we're gonna go shooting.
Yeah. Check out San Juan Slingshots.
Yes.
Link in the description below, I believe.
Uh,
At some
no,
point. We haven't
I'm
got
not very
that.
good at
Well,
that
we're
yet.
back to square one on this motherfucker.
Yeah.
And it's actually on the same desk we started with. So
Original show, The Dumpster Fire.
No, it's just originally when I just had everything on this desk and then it expanded
Oh,
out.
you and the other
It was
Susie.
it was just me and her on this desk. And we had like a makeshift table. Shit, it was fucking weird. But yeah, it was cool. It worked out real well.
Come full circle.
So
but it's
far.
only temporary.
In the fourth segment, we're going to talk about some great moments, and they have nothing to do.
Spoiler alert.
They have nothing
Back
to do
to
with,
dicks.
nothing to do. They have nothing to do with anal. Nothing at all.
But we might be talking about anal anyway. We'll see.
Possibly. We'll be back in a moment. This is Nothing Yet Live.
I am your Miss Parker.
Why do you keep doing that?
Why do you keep not saying your name?
I do. You whenever I say that, do it first. I do it at certain times. So if I go like, I'm the Jay Tyler, then you go.
So I'm not allowed to say it unless you say you're Jay Tyler.
Right. See? Hierarchy. Even though you're higher than me.
Oh.
No, it's just the way that I do it. See? It's all still being fleshed out, even after all these months.
So this is the Jay
If
Tyler.
I just say this is Nothing Yet Live.
This is the Jay Tyler asserting his dominance.
This
Note the Jay
is
Tyler.
what you guys get. This is what you guys get. You asked for it. You get a full beard, no mistakes. At least none by me.
You just made one.
The mistake was Jay Tyler.
I'm just the bitch in control.
I was gonna say I could play something with your voice. See you in a minute. This is Nothing Yet Live. I think that went out.